to go ahead and get started. I want to thank you for being here. Thank you so much for making the time to come to this call. To be present and to be willing to take this time for yourself and um, listen to what your pain is telling you that needs your attention. So thank you so much. I'm so glad you're here. I'm grateful. And I am looking forward to spending this next hour with you. As always, we start by a brief introduction and a reminder that this is not a medical call. We're here to talk about mindfulness, mind-body medicine, and things like that. We don't give medical advice. And we ask everyone for mutual respect, showing each other mutual respect and confidentiality. Everything that I discuss here is evidence-based, is based on research. These are not just my ideas or out of random sources, but I am very much committed to being truthful to science and to the most up-to-date medical and knowledge about pain. So that's my little disclaimer here. And I would love for you to find a comfortable space where you feel comfortable. It's pleasant, pleasurable space. I always ask that you bring a glass of water or tea or anything that you enjoy to sip on. And even if you can create a really fun, pleasurable space for yourself by maybe adding a candle or anything else that makes you feel good, or bring your favorite blanket or anything like that. And I would also like for you to have a pen and a journal nearby that you can write in. And last but not least, if you feel comfortable coming on camera, that would be so wonderful. If you don't feel pressured to do so. Anything that we talk about, we share is completely voluntary. You are free to stop at any point. Nothing is mandatory. This is purely as you feel comfortable. So if you don't have anything to drink and you would love to have something nearby, or if you want to grab a pen and a journal, I'm going to give you a minute to do so right now. And while you're doing that, I'm going to start talking about our topic for today, which is going to be about love, self-love, and self-acceptance. Last month, we talked about fear, stress, and the things that you fear. Today, we're going to talk about love and how important it is in recovering from pain. So, because some of you today are new, this is your first time, I'm gonna revisit the idea of mind-body medicine and what it means, and the fact that what we talk about here, the foundation of what we talk about is that pain is a message. Okay, pain is is really just a message. And the work we do, both in the office, the medical office, and outside, such as here, is to try to uncover this message and decipher the message. And we start to explore mind-body medicine. Really, I think the best time is after having a real medical evaluation where physical problems are evaluated for, and anything that's truly dangerous is eliminated and addressed first. Because pain is a message, and it could, and as I'm going to explain in just a minute, that message could be anything. So, um, so I'm going to give the example or an analogy of an electrical system. If you can have a problem with your power, with your electricity, regardless of where the problem is happening along the, like anywhere within the system. So you have your cables running to your house, then you have the power lines traveling wherever on the power grid, and then it all goes to the central electrical station where the power is generated. So if we can use this analogy to think about your pain, you can think of your brain being the central processing system. All pain, all power comes from the brain. The brain is in charge of everything and controls all the messages, all the systems in your body. And then we have our spinal cord and nerves and then tissues. And so wherever along that path there's a problem, you can receive the message of pain, because pain is just a message that's meant to alert you that there's something that needs your attention. So again, you can have a problem. Let's say I cut my finger and I have pain from it. The message that the pain is telling me is that, hey, look at your finger. Maybe, there's something going on there. It needs your attention. You've cut yourself. Okay. But if I have a pain that's less visible to my eye because the pain is coming from a problem deeper within my finger, within my arm, somewhere along the power line, that's equally real and equally important. But again, it's just a message that we need to then turn our attention to and try to understand. And further along, if the pain is actually generated by my brain for a different reason, because of a different problem that I'm experiencing, that pain is equally real, equally important. And again, my job is to try to understand where is it coming from? Why am I having this pain? So wherever along the power system, the electrical system, wherever along the nervous system the problem occurs, the pain and the message is equally important and equally real. One mistake that some people make is that they only think that the problem is valid if I can see the problem. If I can see that cut finger, if I can see the nerve damage or whatever it is, if I can see it with my eyes, only then I believe it's real. But if it's somewhere along the pathway where I cannot see and I cannot see into my own brain, then I'm making this up. So could not be any further from the truth. In fact, the brain is absolutely responsible for everything in your body, including your breathing, including your heart. Your brain controls everything. And if the brain itself is where the pain is generated, then it's absolutely equally important and real as a problem that's generated anywhere down the nervous system. So because pain is a message and a signal of some kind of danger, some kind of harm to your body that needs your attention, wants your attention, needs to be something that grabs your attention, because it's a signal of damage, some kind of damage, some kind of harm, something going on. What happens psychologically as a response to that is a sense of fear. And that's how it should be, right? If there's a problem with your health or well-being, our response is to be scared, to be a little bit afraid if you until you understand the problem. But if you don't understand the problem, the initial response is one of fear, of threat, of feeling scared. What's going on? And then so this is where we get into the pain fear cycle. Pain is a signal of threat, of harm. It generates the feeling of threat, a feeling of fear. Sorry. If the pain does not get addressed and understood and taken care of, the sense of fear goes up. And when the sense of fear goes up, and again, the pain does not go, it continues to go unresolved, then then the pain goes up. Pain goes up, fear goes up, fear goes up, pain goes up. And that's how the pain fear cycle leads to intensification of pain over time if it again if it continues to go unresolved. So the fundamental task that we need to do is to disrupt this cycle by eliminating or allowing the sensation and understanding that the pain is not something to be scared of. It's just something to be understood. Okay. And in order to understand something, we have to calm our nervous system and reduce the fear. The best way to reduce the fear is through the practice of self-love. First, you have to understand you're safe, and of course that the pain is not really truly something dangerous, because that's where we do the medical evaluations first, make sure it's not a heart attack, make sure it's not a tumor or something like that. And once you know that's not the case and it's something a lot more complicated, then we do this kind of stuff. Before I talk about love, self-love, and how that is the most powerful way to respond to fear, I'm going to tell you about the 3 main types of mind-body pain that I discussed last month as well. And just to kind of help you understand what I mean by the mind-body stuff. So the 3 main types are, number 1, pain as a pattern recognition process done by your brain. So there's a concept of predictive coding in neuroscience. And what it is essentially your brain always wanting to predict what's going to happen next that's going to keep you safe. Because your brain, its fundamental job is to keep you safe. So your brain is constantly processing all the information from the outside, remembering things that happened in the past, and predicting what might happen next, in the next moment, in the next, in your future, what might happen, so that you know what to do to stay safe. So if, for example, you lifted a 20-pound box 6 months ago and you developed a sudden onset of severe pain in your back, your brain is going to remember that. And if that's something that, especially if it's something that happened more than once or it lasted a long time, the pain, your brain is definitely going to remember that experience. And next time you bend over, try to pick up something, you're going to immediately remember what happened before. And sometimes you're going to experience the pain again, even if this time you did not develop a problem. So that's the concept of learning the patterns, your brain learning the patterns for pain. Just like we learn patterns for everything else. We learn that, if it rains afterwards, the air feels more fresh. You already can smell the air feeling more fresh because you know how it was before. You can literally feel the sensation because of that learned, process, that pattern recognition. So the same idea applies to pain. So that's number one. Number two is another concept in neuroscience, and you may have heard this one, called neurons that wire together, fire together. So if you have experienced pain and something else at the same time, whenever next time one of these you're experiencing in one of the things, the other one is going to come with it. So, for example, you were in a car accident and it was nothing serious, you were rear-ended, but it did cause you some neck pain or back pain. And it was also emotionally very traumatizing because, as car accidents always are. So you felt for a brief moment, but you may have felt really scared that something very serious just happened, that you may have gotten very seriously ill or injured from this event. And you are also feeling that physical pain. Next time in the future, you develop back pain or neck pain, that pain might again be experienced with that feeling of fear, of feeling scared, something really bad's about to happen. I'm not sure what's going on. That tension, the stress, that reaction might be experienced again. And vice versa. You experienced the neck or back pain along with that sensation of fear and stress and injury. The next time you feel some neck pain because you were sitting at your computer too long, you're going to have that stress again, or something stressful happens in your life, that neck pain will come with it, even if it's unrelated to that particular event, because neurons that fire together wire together, and then they're both triggered again at the same time, even if one of them is just from the memory part. So that's number two. And number three, type of mind-body pain that I will share with you today is emotional pain that is experienced as physical pain. So emotions are the most powerful things that we have, and emotions, painful, intense, difficult, strong emotions that are not properly processed are not going to go away. They're going to be stored in your body, especially things like grief, trauma, loss, feeling of unsafety. There's so much that can go with this category: feeling of not belonging, feeling judged, feeling rejected. All those feelings, particularly the ones that lead to feeling unsafe in some deep emotional way, are not going to go away on their own just because we say that we shouldn't have those feelings or they should go away, I should be over it. They're going to be stored in your body and come out as physical symptoms sometimes. We call this in medicine pain somatization or somatization syndrome. It's a real described issue. And there have been studies that looked into this and proved that there was a particularly one study that became very famous or turned to be very famous, where people were purposefully subjected to feeling social rejection. And those people were their brains were scanned through functional MRIs to see what parts of their brain would light up. And there was a lot of overlap between the parts of the brain that were active when the individuals in that study felt social rejection, as where people who have chronic pain have those active centers in the brain. So we know for sure that emotional pain will also trigger parts of the brain that are responsible for physical pain. Okay, this is very important. So back to the idea that pain is real regardless of where along the pathway it is generated. And we cannot dismiss our feelings and our symptoms and our sensations just because we don't see physically with our eyes where the problem is. Okay, because pain is always real. If you feel it, it's there. Okay, it's not made up. And a lot of times when people have been in chronic pain and they don't see the full source of their pain, they get into this fear cycle, pain fear cycle. Another emotion that can come with it is self-blame, self-attack. I should be better than this. I shouldn't be feeling like this. Something's wrong with me. I am wrong. I am defective. I'm not good enough. I should be able to get over this, should be able to control this. And anybody who has had chronic pain will at some point have these thoughts and feelings, particularly men, because the society has less allows men less to be not okay. So that sense of self, sometimes even self-hatred, and I don't want to use that strong of a word, but I want to contrast it with love. Because so love is the ultimate feeling that defeats fear. If you're experiencing the sense of fear that something's wrong with you, you can try to tell yourself, I am safe, I'm okay. The doctors have told me whatever's going on with me is not dangerous, it's not going to cause me lifelong disability or injury or damage, but it still does not feel like I'm okay. And some of the practices that we do here, the deep breathing and somatic tracking, are things to how we can control it, but how we can respond to it. But one other very, very important and powerful way to respond to it is by really responding to yourself and what in the experience you have with self-love. Fear is I am not okay. I am in danger. I am alone. I'm not going to handle this. Love is I am okay, exactly as I am, and I am on my own side. I will protect myself and I will treat myself well, regardless of what I'm struggling with. That whatever I'm struggling with is okay to struggle with. I am okay to be where I am. And on that note, I would like us to do this delayed but introductory self-love prayer. So I'm going to say this little prayer here. Play this music in the background as I'm saying this. Dear God, dear Creator, Creator of the universe, today we ask that you help us to accept ourselves just the way we are, without judgment. Help us to accept our mind the way it is, with our emotions, our hopes and dreams, our personality, and our unique way of being. Help us accept our body just the way it is, with all its beauty and perfection. Let the love we have for ourselves be so strong that we never again reject ourselves, sabotage our happiness, freedom. Help us, God, in this journey. Amen. What I would like us to do next is do our deep breathing practice. And then we're going to do some journaling. So for the deep breathing, I'm going to share my screen with you. And we're going to do this 5-minute deep breathing exercise.
Welcome to this 5-minute guided 4-7.
So make yourself comfortable. And we're going to get started.
8 breathing exercise. In this session, we'll use a simple yet powerful technique designed to help calm your nervous system, reduce anxiety and stress, improve focus, and promote better sleep. This practice will help your body and mind settle into a peaceful state, leaving you feeling refreshed and centered. You can do this exercise sitting comfortably or lying down. And if you're comfortable, gently close your eyes to help bring your focus inward. We'll inhale for a count of 4, hold the breath for a count of 7, and exhale for a count of 8. When you inhale, breathe through your nose and deeply from your belly. This activates your body's natural relaxation response. When you exhale, breathe out through your mouth and purse your lips as if you're blowing out a candle. Doing these will help slow the breath and deepen the calming effect. Listen to my voice as I guide you through 4 cycles of the breath using a gentle rhythm with a brief moment of stillness between each cycle. If you're ready, let's begin. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Inhale, 1, 2, 3, 4. Hold, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7, 8. Now allow your breath to return to its natural rhythm. As the music guides you, let the calming effects continue to move through your body. Carry this sense of calm with you, whether you're continuing your day or gently drifting off to sleep. Thank you for breathing with me. Be well.
Excellent. Okay. I hope you all are feeling a little bit more relaxed right now and feeling the calming effect of deep breathing. Remember, deep breathing is what decreases stress and regulates your nervous system, takes you from the stress response, the fight or flight, into the calming, the relaxation, the state of safety as opposed to a state of fear. So I encourage you to practice this as often as you want, as often as you can. So let's go ahead and take your journals out. And we're going to spend about maybe 5 minutes journaling. And today the prompt I have for you is, what would I do differently if I loved myself more? How would I respond to my pain? How would I respond to myself in general? What would I do differently if I really loved myself? Okay, so see if you can come up with 2 or 3 things that you would do differently if you truly were more loving towards yourself. I'm gonna give it 5 minutes. Okay. I'm going to pause right now. I'm very curious to know what has come up for you as you were journaling on this topic. What would you do differently if you loved yourself better? But I'm going to um, allow you to practice this a little bit. So I'm going to talk about the practice of somatic tracking. I'm going to write this in the chat so you can look it up on your own after the call. Somatic tracking, okay, is the name of this practice. And what it is essentially allowing yourself to feel the pain in responding to it without judgment or without needing to control it. So practicing a little bit more neutral way of responding to your pain and more with curiosity rather than judgment. So go ahead and you can close your eyes or you can leave your eyes open, however you prefer, and turn your attention to the part of your body where you're experiencing pain right now. So really focus your attention on where you're hurting. And think about um, what does it feel like? What is this sensation like? Is this is the pain, does the pain feel sharp or dull? Focus on where it's located. Is it in your shoulder or neck or arm or head, or where is the pain located? And in as if you were observing it from the outside, think about now what qualities would you give it? Is it intense? Is it mild? And notice how your what your this immediate response to this pain is. And now go ahead and take a slow, deep breath and remind yourself that you are safe. This pain is not here to harm you, is not here to needs does not need to be controlled. You don't need to make it go away. Remember that the pain is just a message, and it is your body trying to protect you. And see if you can respond to it with a message of self-love and gratitude. Thinking about how wonderful your body is to tell you that there's a part of you that needs your attention. And that part of you needs your love, needs you to not be upset with yourself that it's hurting, but it needs you to show it that you are going to protect it. You are going to ask it questions. What what do you need from me? Because I love you. I care about you. And I'll take care of you no matter what. That part of you that is hurting needs your love, not judgment. Not control, but your love. You speaking to it with kindness and curiosity. So go ahead and take a few more slow, deep breaths. And notice the pain, notice the sensation. And speak to yourself those messages of self-love. You are safe. You are loved. You are held. You are guided. And you are okay. See what you're noticing as you're doing this exercise. Is there anything that you're noticing